Good day, everyone. I'm Rosemary Borreo Carreras from Bachelor of Elementary Education 3A. Now, I'm going to discuss you about menstrual cycle. The menstrual cycle starts on the first day of the menstrual period and ends with the start of the following period. It is made up of the four phases during which hormones change to prepare women of pregnancy each month. But before I continue to discuss your menstrual cycle, I will show you one picture.
Menstruation, also called having a period. As girls get older and their bodies change, they get their periods. The uterus is the part inside the body where a baby grows when a woman is pregnant. The inner lining of the uterus supports and nourishes the developing baby. If there is no baby, the lining is shed during her period. During a period, blood and other tissue from the uterus leave the body through the vagina. A period can last from a few days to about a week. You may have heard doctors talk about the menstrual cycle. This is the time from one period to another, usually about 28 days. Day 1 of the menstrual cycle is the first day of a period. The uterus starts to shed its lining. As soon as the period ends, the uterus prepares again to receive a fertilized egg. Eggs are released from a woman's ovaries. Eggs are super tiny, 1/10 the size of a poppy seed. Women have two ovaries, one on each side. The fallopian tubes lead from each ovary to the uterus. In the middle of the menstrual cycle, an ovary releases an egg. After ovulation, the egg travels down the fallopian tube. It takes a few days to complete the journey. Meanwhile, the lining of the uterus gradually gets thicker so it can support the development of a fertilized egg. If the egg gets fertilized, it will implant in the uterus and the woman is pregnant. If the egg is not fertilized, the woman is not pregnant and the egg will begin to dissolve. Because the woman is not pregnant, the lining of the uterus is not needed. A woman will have her monthly period, and the cycle begins again.
That is the female reproductive system. As you can see, that is fallopian tube, that is ovary, uterus, cervix, and vagina. Now I will discuss you first the vagina. It is canal between the uterus and the external reproductive organs. That is vagina. Uterus, it is hollow pear-shaped organ where the fetus grows during pregnancy. So, uterus, it is the first home of the baby. It is our first home. Fallopian tubes. There are narrow canals connected to the upper parts of the uterus. Through them, the eggs travel from the ovaries. Then, just a ovary will stack the eggs, then will transmit it to the fallopian tube and stay in uterus. Ovaries. They are small oval-shaped glands located on the sides of the uterus, eggs from inside the ovaries that also produce female hormones. That is menstrual cycle. First, the follicular phase. First, the eggs were developed into the ovary. Next, ovulation phase. The uterus. In second ovulation phase, the uterus will thick. Then third, luteal phase, egg release into ovaries. The next menstrual phase, endometrium sheath. That is menstrual cycle. Menstrual cycle. A menstrual cycle consists of natural change that occur in women's but every month in preparation of pregnancy. Menstruation starts at puberty and ends at menopause. The cycle lasts an average of 28 days but may vary between 20, and 40 days. The first menstrual period, our first menstrual period, was begins at puberty between the age of 8 and 15, average age of 12. It is usually start 2 years after breast and public hair start to develop. Phases of menstrual cycle. The menstruation is the elimination of the internal lining of the uterine, well along with other secretion from the body through the vagina. Follicular phase that I will um, said you say that I will teach you later. The follicular phase start on the first day of menstruation and ends in ovulation. Ovulation occurs 12 to 16 days before the following period, but not necessarily in the middle of the cycle. The term ovulation indicates the formation of mature egg by one of the ovaries. Luteal phase. During this phase, the follicle from which the mature egg bursts out. Next, we're going to premenstrual syndrome or PMS. Some psychological and physical changes may occur during the luteal phase are called breast tenderness, diarrhea, bloating, cramps, headaches, fluid retention, fatigue, and vertigo. And that is premenstrual syndrome. As you can see, when you're experiencing menstruation, you can feel irritability, mood change, vomit, swollen breast pain, increased appetite, headaches, back aches, muscle pain, and some acne. Psychological changes, aggressive behavior, trouble sleeping, too much or too little, changes in appetite, difficulty concentrating, stress and anxiety, mood swings, depression, reduced libido. Now we're going to primary dysmenorrhea. It is a very common condition that occurs between of the construction in the uterine muscle. It typically occurs during adolescence and fades away with age. You are more likely to suffer from primary and dysmenorrhea. First, you started menstruating before the age of 11, have heavy and long periods, smoke, experiencing psychological pressure. Now we're going to second dysmenorrhea. First, endometriosis, uterine fibroids, ovarian cysts, and irregular periods. A girl body begins to regulate her menstrual period 2 years after the cycle starts. During this time, the body tries to adjust to the hormonal change it is experiencing. A cycle is considered to be irregular if it is shorter or longer than usual. There are some um, following problems and see a doctor if any. First, if the during puberty, if the menstrual cycle begins before the age of 8, a girl is 15 years old but has not started his cycle. If the cycle does not start within 3 years or breast development, if the menstrual cycle remains irregular after the first 3 years, next, during menstruation, if the symptoms are severe, if painkillers don't help relieve menstrual pain, if large and abnormal clots, if cramps are felt outside the usual times before and during. Now, we are problem occur outside menstruation, bleeding after intercourse, bleeding outside menstruation period, bleeding after menopause, And that's all menstrual cycle. I hope you learn. Thank you and God bless.